asking me, don't you find it questionable that she's growing a baby for spare parts? Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi. Blood cord banking has been raising some ethical issues, and there's one that I would like to present to you and see what you think of it. So put your comments below. So I knew a nurse that was the most competent, the sweetest nurse at the delivery room. And sure enough, at one point I was selling my little bicycle trailer because I don't have the legs and the breath to pull babies with that, so I hated the darn thing. So I sold it to her for 20 bucks just to, get rid of her. So we got to talk, and she said she wanted to do a lot of bicycling around with her son that was about 7 years old. I'm not sure of the age, because he had a very severe cancer, a form of leukemia that did not respond to anything, and she wanted to spend some quality time with him, which she got the occasion to do. So the son would be in the trailer because he could not use a bike. He was too weak for that. So she had great moments with him. So her story is that they tried everything, of course, because he was so young. He was, like I said, around 7 years old. They tried very aggressive chemotherapy and then bone marrow transplant, which he rejected every time. So she was kind of in despair. So every bone marrow transplant that they tried, he rejected, and he got sicker. So she was kind of in despair of saving her little boy. So she decided to get pregnant, even though she didn't want any more kids with all that she had to do with going to the hospital and all the treatments. So she decided to get pregnant so she could do private cord blood banking and hopefully try to save her son with the baby's stem cells at birth. You can see the other videos how they do it. It doesn't hurt the baby or anything. The ethical thing is that everybody was judging her at the delivery room. They would whisper, but quote unquote whisper so loudly, and pointing at her and judging her. And I even heard one nurse saying, don't you find it questionable that she's growing a baby for spare parts? And I was, oh my God, no, it's a mother trying to save her child. And she will love the baby, I'm sure. She did not plan on having another baby, but the stem cell cords is just one part of the life. And what could be better than a newborn that saves life? You're the youngest donors, like you see in those publicity in the magazines about cord blood banking. But not everybody, but a lot of people were judging her, and I found that pretty harsh. So I want your comments below. Would you get pregnant to have, because this is one of the best example, the best way of using the cord blood banking is for a sibling, to treat a sibling, because the baby, they will check, but the baby does not have that genetic code of developing a leukemia. So it could save the big brother. Again, there's all kinds of restrictions. There might not be enough blood in the collection. So she was taking a leap of faith, to say the least, or a gamble, call it whatever you want, to see. And I'm sorry I don't have the end of the story. I do not know what happened to the child. We kind of parted before she gave birth, so I don't know how her son did, and if they could even do a transfusion of the stem cells, and if that helped the child. But put your comments below. Would you get pregnant but to save an older sibling? Because that's one of the indication of doing cord blood banking. See you on the next video. Bye-bye.